investments, and they deserve our respect. Ladies and gentlemen, as we've heard, to reduce maternal mortality in this increasingly unpredictable and challenged financial environment also demands us to be bold and creative with our financing, moving beyond traditional aid models. This means, among other things, embracing local innovation. Look at the digital health solutions, the apps, and the local supply chain innovations that we know have been developed right here in Uganda. These are low-cost, high-impact digital solutions, and they're often the smartest investment when you have a tight financial landscape. Doing the leapfrogging, getting away with more expensive models, using technology to get to a point where we can use our financing smarter is not just the smart thing to do, it is also very necessary in the current environment.
This is also the science that we have all the methods. We have all the methods. We have all the methods available in Uganda. No one should say that we love this, at service delivery points. But also in the footnotes that about 30% of our women are using long-acting reversible contraceptive methods, like the implants, long-acting but reversible. They are good because they give you more couple years of protection. The most utilized method is Cyanopress, the injection for 3 months, and we have enough stock.
Find strategies. Can we work together as partners? Find resources. The Service Commission, we are very, very happy that the chair is our own, the former Director General Health Services, who understands these problems. We are looking to you. When we're discussing and engaging, because we are trying to find a real gap with the Commissioner midwifery, according to the statistics, the new structure, service structure, and the old one, we need around 10,000 midwives to be able to address the gap. So we need to work together. The gap is real and the challenges are real. If we can be able to address that, then we'll be able to move on. The other challenge we found out was, whereas our commissioner affirmed that we have medicines and supplies for maternal and child health, we realized that the stocks are doing very well in joint medical stores and also the health facilities, but the last mile delivery, when it gets to the communities, we still have a gap. Most of these were funded by partners, and you know what has happened to our landscape. So we need to work on the distribution and redistribution so that the last mile deliveries are happening. But we are assured by Ministry of Health that that is being done. When it gets to innovative financing or domestic resource mobilization, we've been doing this for over years, and we are glad that there's a shift. In the new budget, we got 4.4 trillion on the healthy sector, but that's healthy sector. But also we are very happy that we have what we call Vote 116 that goes to reproductive health commodities and services. We are advocating for more, but there are other ways. And in this meeting or in this conference, we are calling upon you. We've advocated that we get what we call sin taxes. When you drink beer, eat sweets or anything sweet, you're taxed. And that money right now is sitting in URA. So how can we get that money since they are affecting our health? And part of it is even reproductive health. How can that money come back? So that they address the damage that they are causing, including our newborn. You know what happens. I'm not a medical doctor, but I'm a public health.
The bank has also been in funding other several projects in support of maternal and child health care. We've supported organizations like Rotary, clubs, and other organizations that have projects that resonate with our theme. These interventions reflect our belief at the bank that investing in the health of mothers and children is an investment in Uganda's human capital, and therefore Uganda's future. To sustain the gains, but before I get to the gains, in addition to the health centers that we have supported, and we are still supporting, this financial year, the Bank of Uganda is taking up yet again other 3 health centers, and with the support and recommendation of Ministry of Health, we are taking up a health center in Kasese district. We are also going to support a health center in Kitgum And we are also going to support her health center in Moroto district. We are trying to traverse the entire country and see where we can help. And not only do we do construction of maternity health wards, but we also support in procurement of equipment. And this equipment is not determined by us, the central bank, it is determined by the districts and the health center. So they give us a list of the needs that they require, and then we approach the medical stores and we procure that equipment. So to sustain the gains in maternal and child health, we must all be committed to strengthening domestic revenue mobilization through, for example, fair and efficient tax systems, prioritizing health in our national budgets with clear allocation to maternal and child health.
Government, partners, civil society, private sector and communities mutually accountable for ensuring that no woman dies while giving life and no girl becomes a mother prematurely. As I conclude, now more than ever, with one death far too many, the insufficient progress made in saving mothers' lives and preventing unnecessary deaths should serve as a clarion call for urgent collective action by all of us. To the midwives, nurses, doctors, teachers, and community health workers represented here, you are the heartbeat of safe motherhood and our indispensable first line of defense in reducing maternal morbidity and mortality. To our political and cultural leaders, your continued leadership and voice are vital in turning evidence into action and leading to positive behavioral change. To the private sector and civil society, your innovations, investments, and reach are helping extend services up to the last mile. To our communities and parents, thank you for nurturing the change we all wish to see. You are not alone. And of course, to our development partners, a big thank you for the sustained support and commitment despite all the challenges. On behalf of all health development partners, I reaffirm our shared commitment to stronger systems, sustained financing, empowered communities, and the realization of every woman and girl's right to health, safety, and dignity. Thank you. Uganda's persistently high teenage pregnancy rates poses a significant threat to newborn survival. Pregnant adolescents are not only at increased risk of maternal complications and death, but their newborns face elevated risk of prematurity, low birth weight, and neonatal mortality, contributing to the country's newborn mortality rate of 22 per 1,000 live births. Addressing teenage pregnancy, therefore, is not merely a reproductive health priority, it is a strategic lever for improving newborn outcomes and accelerating Uganda's progress towards the Sustainable Development Goals. We cannot achieve safe motherhood without keeping girls in school, providing sexuality education, and ensuring that adolescents and youth have access to accurate information, contraceptives, and HIV prevention services that meets their unique needs. The modern contraceptive prevalence rate has risen to 33% among all women, yet the unmet need for family planning remains high at 20%, especially among adolescents.
Global, regional, and national level, WHO will continue to advocate for investment in primary health care to achieve the novel goal of universal health coverage, the key foundation for sustainable motherhood. As we open this very important conference, I invite all of us to use this platform not only to reflect, but also to recommit to action, accountability, and collaboration. Let us ensure that our discussion translates into concrete, coordinated steps that bring Uganda closer to a future where safe motherhood is guaranteed for every woman, everywhere, every time. Distinguished delegates, Uganda's success story gives us hope, but standing and sustaining and accelerating progress required continued leadership, innovation and solidarity. WHO remains committed to walking this journey with all of you because safe motherhood is not just a health goal, it is a human right, a moral duty and a cornerstone for sustainable development. Thank you very much.
And this is about domestic revenue mobilisation, but it's also about accelerating domestic financing strategies. So as we begin this conference, I encourage us all to reflect on how we can deepen collaboration, close persistent equity gaps and ensure accountability for results that truly change lives. And as I conclude, let me say that the UK remains a long-standing friend of Uganda. We continue to deepen the partnership and the enduring people-to-people relationships between our countries, not least in the health sector. Safe motherhood is everyone's responsibility, and indeed, it is our shared opportunity. Thank you very much.
Further up. But by the time she reaches Kawempe, she's ruptured and she's dead. So let's, government, we must find a way of solving this problem. Even if it means, even if, I know the DG is about to chase me, let me stop there. But we need to address that problem, because now, if I recover my 80 million, when I start the process of recovering my 80 million, by the time I recover it, they have already developed a culture of extortion. I will not stop at 80 million, then I will continue charging mothers. So let's really address that. Finally, Dr. Pius Okong, before he left, he had started a process of developing standing orders for health workers. We are finalizing those standing orders.
We continue to see that a few of our pregnant mothers, deliver within communities without skilled birth attendants. We also note a high number of stillbirths, pregnant mothers attending less than 8 recommended ANC contacts. And we also note gaps in the quality of care, systems, mainly due to poor performance management, limitations in human resources, and limitations also in health infrastructure. And I think this speaks to leadership and governance. A number of things have actually been highlighted here by the chairperson of the Health Service Commission. Leadership and governance becomes very, very critical. You cannot achieve accountability where the structures that have been put in place to ensure that systems work go to sleep. You can never achieve accountability. So it's important that we take this by the horn and ensure that we offer critical leadership and hold people accountable for the roles and responsibilities they are supposed to do.
As I present the sub-theme of harnessing culture values and ethics for improved maternal and newborn health, which I have been given to address this afternoon. Now we must focus on approaches that actively engage our predominantly young, vibrant, and sexually active population, characterized by high fertility rates. These strategies should be culturally acceptable, accessible, and resonate with our people's realities, ensuring their effectiveness in driving sustainable and meaningful change. Why do culture and ethics matter? Because while health systems and skilled personnel are vital, they alone cannot achieve safe motherhood. The choices that influence maternal health, such as when to seek care, family size, and how mothers are treated during labor, are deeply rooted in our values, our beliefs, and community practices. Our forefathers' wisdom reminds us that motherhood and childhood survival are shared community responsibilities.
Safe motherhood is not merely a medical issue, it is a moral and cultural imperative. Excuse me. Today, I want to emphasize that our culture, values, and ethics are not just of another approach, and that is collaborating with traditional birth attendants, training them with modern knowledge to bridge culture practices with quality healthcare services. Again, gender and socio-economic empowerment. Let's promote women's education and economic independence, reinforcing respect, dignity, and shared responsibility. Now, here are some practical efforts by the Nabagereka Development Foundation, working within the Buganda framework, Kingdom framework, to demonstrate how these principles translate into action. Community mobilization, leveraging our clan system, Buganda, and counties, Masaza, Gabuganda, to spread messages on antenatal care, nutrition, and family planning, children and youth engagement, using the annual Extakate Camp. It's a program that we've been running for for over 18 years, to equip boys and girls. As I conclude, distinguished guests, I'd like to call on you that we renew our vow to harness the enduring strength of our culture, values, and ethics. These are not just relics of the past, they are living, dynamic forces that can strengthen our efforts to save lives. On behalf of the Kingdom of Buganda, I pledge our continued partnership with the government, development partners, and communities in this noble cause. May our collective efforts lead us toward a future where no woman dies giving life and no child is lost to preventable causes. As it is said in the book of Proverbs, a healthy mother is the foundation of a healthy nation. Let us work together with integrity, respect, and shared purpose to ensure safe motherhood for all women and a healthy future for all our children. I thank you all for listening.